Hi, everyone. Welcome to our presentation today. The title is Co-Creating Knowledge Translation Outputs in Patient and Family Partnered Research. I'm Jennifer Bombush from the UBC School of Nursing, and I'm pleased to be co-presenting today with our Community Research Liaison, Shauna Lambden-Bennett. So just a little bit of the background of our study. We applied initially for an internal research grant at the UBC School of Nursing, which is a relatively small grant of about $5,000. And what we wanted to do in our study was explore the impact of the pandemic on families of children with medical complexity in British Columbia. So if you'll recall, the pandemic really hit British Columbia in March 2020, and that was around the time that the internal research grant call came out, and Shauna and I worked together to submit an application. The methods for this study initially were supposed to focus on just the qualitative interview component of the study. However, we shifted, and Shauna will talk more about this in a few moments, to doing a cross-sectional survey, which was administered with parents of children with medical complexity in British Columbia during the month of August 2020. And then we continued to collect more data starting in August 2021 using semi-structured interviews to learn more about how the previous year of living in the pandemic had impacted families. The results of our study so far, the survey results indicated significant impact on children's access to health services and education, as well as negative impacts on parents' mental health. So recall that that survey data was collected in March 2020 and was really reflective of the first wave of COVID-19 and the summer that followed. So the knowledge translation output so far from our study have included an infographic that was co-created by Shauna and another parent, a public report that is available on UBC's open access portal, which is called The Impact of COVID-19 on British Columbia's Children with Medical Complexity and Their Families. That particular report has already been reviewed and viewed over 2,000 times in just the year plus that it's been available. And we have just recently had a peer review publication accepted, which is entitled The Unintended Consequences of COVID-19 Public Health Measures on Healthcare for Children with Medical Complexity. And that will be coming out in an issue of Child Care, Health and Development pretty soon. I'm going to hand it over to Shauna now to talk more about our research collaboration.
So my role here today is to talk about cultivating relationships with patient partners. Jennifer and I, we first met as friends on a Facebook group that was sort of devoted or focused to helping parents navigate the complexities around equitable access to education for children with extraordinary learning needs. And out of that connection, a friendship was born. But we soon realized that we both had a love for academia, well, a love-hate for academia, and we're really invested in research. I come from a family of clinicians and physicians and professionals, and so I was already very comfortable in that environment, and so it was a really good transition and a way for us to move forward in looking at ways that we can leverage that relationship to affect positive change within our own community. Next slide, please. So following up to what Jennifer shared about the study was sort of initially focused on the first few months of the impact of COVID-19 and on medically complex children and youth and their caregivers. I guess it was early 2020, and we knew that as well-informed and positioned as we were struggling. And that meant that our community, many of whom are less privileged, were barely treading water. So we wanted to leverage our skills and our connections and our friendship to sort of look at ways that we could hopefully affect positive change for our community. And this study, and what was really important to me from the outset, was including fair compensation for participants, which was a way to bring voice and meaning to our collective experiences, but legitimizing the role of patient partners and participants in bringing them to the research table in a way that promoted equity. Next slide, please. So how do we do it? We use our personal relationship as a foundation. We recognize that we each have different skill sets, and we encouraged each other to take on areas of responsibility that reflected those skills. Jennifer is fantastic with data. I'm not so fantastic with data, but I'm great with putting together presentations, and I have good social relationships and connections within the community. So we each sort of focused on our areas of skills and leveraged that to engage other families, which allowed us to, I think we had 162 novel participants in the first round. We also used tools that supported asynchronous communication between ourselves and our graphic artists that allowed us to get the work done in a way that respected individual schedules. Next slide, please. There are individual benefits to researchers, patient partners, and participants. Having a patient partner on a foundation, as part of the foundation of your process, it really encourages research teams to take and maintain perspective, because patient partners bring a dose of reality and they help keep things grounded. And early career researchers can see long-term benefits from building a strong foundation of skilled patient partners, and then they can carry that through to other projects. Compensating patient partners and participants keeps people coming back, and there's more reward for the investment of your time, and people are less likely to be lost to follow-up. Next slide, please.
For people to think about. A big piece is around research ethics. So I think over the last few years, we've seen a lot of progress in patient and family partners on studies, to the point where now Shauna is listed on our research ethics certificates and is totally integrated into the research team. So as part of that is ensuring that partners are familiar with research ethics expectations and protocols. And so you need to check with your own institution around those guidelines, but certainly they involve things like completing Tri-Council tutorial and ensuring that everybody on the team is clear on research ethics expectations. I think in this particular study, as it was sort of our foundational study, it helped to have a really flexible methodology. So as I said at the beginning, we were thinking about starting with semi-structured interviews, but Shauna came in and it was really clear that we needed to make the study accessible for as many people as wanted to participate, and that should be our priority. So we pivoted to doing a cross-sectional survey, which we were able to do also because we had a flexible funder with an internal research grant at that point. And it allowed us certainly to get a much more in-depth and broader view of what was happening in the province. I think it's clear from what we both shared that it's really key to integrate partners from the very beginning of a study, not to bring them in part way or to engage in any tokenism in their involvement, but really help they can play a critical role in co-creating applications. And I think this is the third time we're mentioning this, so clearly it's really important. And really the onus is on the researcher to ensure that you've budgeted appropriately for compensation and reimbursement. And again, I think that there's been lots of progress in this area over the recent years, and we have really good guidelines around that. And I mentioned both compensation for the individual's time, but also the key part around reimbursement. So in our study and in our community, many people need to have support workers or regulated staff to support their children who are medically complex while they're participating in research. So that's a separate consideration to be budgeted for, that it's not just paying people for their time, but to reimburse them for any costs associated with participating in research. And that can be a real barrier for some participants, sometimes the participants who you most want in the study. So making sure that you're able to attend to those. The last slide is a bit of a celebration. So what are our next steps? We were really fortunate to be able to use this study as a foundation to get a CIHR grant through a special call to look at what is happening and how families are being impacted during the pandemic. And so the next step of our research collaboration will be the study Understanding the Impact of COVID-19 on Children with Medical Complexity and Their Families. This is a study that will be based in British Columbia. We will be following families over time to see what their experiences are. We completely expect that these families are going to be experiencing the ripples of the pandemic for many months to come. So we're just starting to launch that particular study. We've also been expanding and consolidating the team. So it's really important to bring in clinicians and, as Shauna mentioned, early research career scholars so that they can be part of this team and also be learning about how to include patient and family partners in their research. So we'll wrap it up there, and we look forward to your questions when we get to the question period.